Hello, everyone. May is Ehlers Danlos Awareness Month, and I thought I would talk about it because I have it. So let's get into it. Ehlers Danlos isn't very well known. I end up having to explain it to most people I meet. Sometimes I have to even explain it to my own doctors. But to be fair, I do live in rural Maine, so that might not be the case for everyone. I strive to spread awareness through my art, so I thought it would be perfect to do this for Ehlers Danlos Awareness Month. I said that weird. Ehlers-Danlos is a rare genetic disorder that has 13 types. All of the types can be identified in a genetic panel except the most common one, hypermobile Ehlers-Danlos syndrome. It was said to affect 1 out of 5,000. However, it may be even more common than that, as increased awareness and better diagnostic criteria makes a diagnosis more accessible. Scientists and doctors are currently still doing studies to identify the gene that causes hypermobile Ehlers-Danlos syndrome. Man, it's a mouthful. I'm currently in one of the studies that are spanning across the US. Basically, they use a biobank that holds extra samples from my previous procedures like biopsies, blood draws, and spit for them to study. Though I do have to redo my DNA test because they lost it. Can you believe a fancy hospital can lose a test? Yeah, apparently they can. Though they are worried that I might have a more serious type of Ehlers-Danlos syndrome, so I don't know. I've kind of been avoiding it, and I shouldn't, but I'm a little scared. Anyway, that's besides the point. A genetic panel is the only way to test for all types of EDS except hypermobility. The test consists of seeing a geneticist and spitting a lot in a tube. The tube gets sent away to a lab and they test for 12 specific genes. Classical, the second most common after hypermobility, albeit still rare, out of 1 out of every 20,000. It presents with stretchy skin and joint hypermobility. It is the most similar to hypermobile EDS, but there is a gene identifier for this one. There is a defect in the type V collagen and type 1 collagen proteins, and the genetic marker is col5a1, col5a2, and rare times col1a1. You might know what the genetic markers mean. I don't. My fancy science sister does, because she's cool like that. Classical like, known as CLEDS, affects the protein, I'm going to do my best to pronounce this, tennessine XB. The genetic basis for it is TNXB. Sorry for pronouncing any of that wrong. But classical like Ehlers-Danlos is very similar to classical. That's why it's called classical like. But it's a different gene. Vascular Ehlers-Danlos, also known as VEDS, is a rare subtype affecting 1 out of 100,000 and is associated with life-threatening complications like organ ruptures. The genetic basis for it is col3a1, and in rare times col1a1. The protein affected is type 3 collagen, and in rare cases type 1 collagen. Similarly, cardiac valvular, known as CVEDs, the genetic basis being col1a2, and the protein type 1 collagen. The rest of the types are much more rare, being 1 in a million globally. I will list their names, but I'm not going to list their genetic properties. But I will put a picture of their genetic properties and what genes they affect. The rarest ones are hard to pronounce, but I will do my best. Anthrochalasia EDS, dermatopraxis EDS, kyphoscoliotic EDS, brittle cornea syndrome, spondyloplastic EDS, muscular contractural EDS, myopathic EDS, and periodontal EDS. Yep, there's that many, and it's a lot of genes. Comorbidities are common amongst all the types of Ehlers-Danlos syndromes, and there is a lot, so I'm going to try to list them all by body part. Let me know if you think I missed any. Though it does affect every single joint, so I'm just going around like brain, spine, stomach, joint, like that. Brain and spine, the list is postural orthostatic tachycardia syndrome, which causes an elevated heart rate when going from a laying sit position to standing. This puts extra stress on the heart, sometimes causing fainting. This is in the brain and spine because it's caused by the nervous system, the vagus nerve specifically, and It's not a heart condition. So a lot of times people will see a neurologist for it. I see a cardiologist because some medications can treat it, and they're beta blockers, which affect the heart and blood pressure. So that's why sometimes you see a cardiologist instead of a neurologist for it, but it is caused by the brain. Chronic migraines, Chiari malformation, where the brain tissue protrudes into the spinal cord, chronic fatigue syndrome, mast cell activation syndrome. You have too many histamines and they look for any way to escape. So they can be triggered by allergen like food, the elements, causing flushing, hives, and sometimes anaphylaxis. It can also cause early disc degeneration, craniocervical instability, which is instability of your neck, and neurodiversity. Next, we have joints, early osteoarthritis from chronic injuries like dislocations. Yeah, I call that old people arthritis, but we get it at a very, very young age. Instability of the joint and chronic dislocations. Next, we have digestive, which is gastroparesis, meaning delayed gastric emptying. So food stays in the stomach too long, making you sick and sometimes vomit. GERD, stomach acid flowing back into your throat and causing damage. Hernias, irritable bowel syndrome. It is very common to have digestive issues, especially in the hypermobility section and classical DIADS. Next, we have throat, which can cause vocal cord syndrome, which vocal cords close while you breathe, and it is often misdiagnosed as asthma, but this is quite common due to all the stomach issues and your vocal cords getting irritated all the time from either hives or growing up or the stomach acid. I have it, and that's why my voice kind of sounds like this. It gets hoarse much faster than the average person because my vocal cords and throat are a little messed up. Next, that can also cause rumination syndrome due to a malfunctioning of swallowing that causes regurgitation, which again is due to the connective tissues. Cardiac. This is most common, these symptoms in VEDS, vascular EDS, and it is the most dangerous type of Ehlers Danlos syndrome. It can cause arterial rupture. The wall of the aorta breaks, causing extreme pain in the back or abdomen. You need to call 911 immediately if this happens. It happens most in the two cardiac EDS, and that's why, unfortunately, their lifespan is usually shorter. With constant blood pressure management and having a safety plan with local knowledgeable doctors, which can be hard since the awareness about EDS is not enough that we have. It can sometimes extend life. I think it's most important to raise awareness about vascular types because their life is often cut short, especially due to doctors being unaware. It can also cause mild dilation, not immediately serious, but common amongst all EDS types. The main artery carrying blood to the heart is wider, not life threatening, but it can be a precursor to serious conditions. It's very important that people with Ehlers-Danlos have a cardiologist and get echocardiograms as much as their cardiologist said. I was personally told to do it yearly, but I'm a bad patient and I hate phone calls and forget to, so don't be like me. Next, we have mitral valve prolapse. Valves become stretched out instead of closed tightly. That's risks of prolapse of all organs, really, because of the stretchy skin and faulty connective tissue we have. So we really have to be on the lookout for that. Next, we have bladder. Any bladder disorder is common in all types of EDS due to the pelvis mobility and dysfunction with the nervous system. So that's really common. And next and lastly is the dental systems, which is gum disease, TMJ, like the lockjaw, misaligned teeth. Braces don't work because the teeth are also hypermobile. You would have guessed. Now that we have gone over symptoms and how to test for all of the other types, I'll talk about how doctors test for hypermobile EDS with no blood or DNA test available to them right now due to the missing gene. People with hypermobility EDS will have symptoms their entire life, even through childhood. But it can be hard to pinpoint what is the cause due to common comorbidities causing symptoms throughout the entire body, as I listed before, due to connective tissues being what holds your entire body together. There's a saying that can't connect the issues, think connective tissues. I think that saying is pretty good, I'm not gonna lie. I didn't make it. Whoever did is a genius. Most people with hypermobile EDS will be diagnosed late due to the variety of symptoms. This especially affects women of color, unfortunately, due to the ingrained bias against them in the medical system. And I am a big advocate of the medical system just needs to be changed, the entirety of it, because it's a freaking mess. It should not take a year to see a doctor. Anyway, children with hypermobile EDS will have frequent injuries, no balance, muscle spasms, injuries that will not heal, thick raised scars, atrophic scarring, extra stretch marks, chronic pain. Most of the time, it will be dismissed as growing pains, sit oddly, flat feet, digestive problems, etc. These should be some things to look out for. It is kind of funny how much my life made sense when I was diagnosed because I had all these symptoms and I didn't know how to make friends. So I used to crack my joints and bend my hands backwards to impress others. FYI, didn't freaking work. Later would be told I was making my condition worse, but that's besides the point. By spreading awareness, hopefully doctors will recognize it in younger people. I was personally lucky to be diagnosed at age 17, even though I was in and out of hospitals my whole childhood. I'm still lucky when it can take usually 10 to 20 years to get diagnosed. Sorry, I kind of got off topic about my own experiences. If you are lucky, your primary care doctor will recognize it due to your range of motions. Doctors fresher out of college will recognize it more as it's becoming more prevalent. Doctors are often taught think horses, not zebras, aka think most things are common, not rare, which in itself is kind of problematic because it could be anyone. You should treat everybody the same probability of having something. But anyway, EDS is becoming more well known and less thought of as rare, so diagnoses are getting a little bit easier to receive and get help for before damage is deadly. Once my previous doctor retired, I got one straight out of her residency who was shocked when my mom said, "Show her your pop thing." And I cracked my wrist and was quickly told not to do that again. She said I needed to be tested immediately. Anyway, I'd been partially dislocating my joints my whole life. That was crazy. Uh, I'm lucky my primary care recognized mine, but sometimes you have to educate them yourself. Another reason it is so important to raise awareness this month and really all the time, but this is Awareness Month. Once your primary suspects you have Ehlers Danlos, they will send a referral for you to see genetics. Genetics will request you have an eye exam and an echocardiogram. During the eye exam, they are looking for previous lens dislocations and blue sclera, which is the white part of your eye. It will be partially tinted blue. That is because Ehlers-Danlos skin is thinner and see-through, making veins more visible, meaning the veins tint the whites of your eye, making them have a blue hue. The echocardiogram is to look for heart abnormalities that are common in Ehlers-Danlos. Once genetics receives the paperwork, they will see you, unless you live in Maine and there is only one geneticist, and they will say 50 pages of documentation is not enough. But that was for the best for me anyway, because my doctor was very worried, so she sent me to Boston Children's, which is a much better hospital. But they did lose my DNA, and that's a little scary. Once you get to genetics, they will ask an insane amount of family history. It may even end up connecting back to Ehlers-Danlos. For example, a large amount of my cousins have Chiari malformations, which is a common comorbidity of Ehlers-Danlos. Then they will finally ask all surgery and injury history, which if you have Ehlers-Danlos, it's gonna take a while, unfortunately. Finally, they will do a test called the Beaton scale. You will be scored on a scale of 9. 5 out of 9 indicates hypermobility in an adult. For reference, I have a 7 out of 9. You get 1 point for each side: a pinky that bends past 90 degrees, a thumb that can touch your forearm, elbows that bend past 90 degrees, calf that extends past 10 degrees backwards when knees are locked. Hands flat on the floor without bending your knees. This one makes me very mad though because they didn't count this one for me because my knees bent backwards, even though they aren't supposed to do that. They still bent. Whatever. I'm not bitter. 5 out of 9 indicates hypermobility in an adult, as I said. And I just forgot that I already said that. Sorry. Anyway, the beaten score is how they test for hypermobile EDS with no gene. Currently, there is no cure for any type of Ehlers Danlos syndrome since it is due to a defect in the genes. Though there have been advancements in gene editing, there are clinical trials using gene therapy to cure sickle cell disease. However, gene editing is seen as very controversial because it could be easily misused in the wrong hands if it advanced and quickly turn into eugenics. The ethics of genome editing are very interesting, and I definitely recommend reading about it, but it's not like part of this. Anyway, we will not find a cure for Ehlers-Danlos anytime soon, especially hypermobility Ehlers-Danlos, because the gene has not even been identified yet. The treatments are physical therapy to strengthen the muscle around the joint since the connective tissue is faulty and can't hold the joints together. So the muscles need to be strong to work twice as hard. I was told I will be in and out of physical therapy for the rest of my life. I should mention I'm painting what Ehlers-Danlos connective tissue looks like under a microscope versus healthy connective tissue. Should have started with that. Sometimes physical therapy isn't enough, and from the chronic dislocations, the ligaments eventually snap like a rubber band after being stretched too much. As told to me by my favorite physical therapist, he knows who he is. He doesn't watch my videos, though. He should. It is also important to receive treatments for comorbidities because sometimes they can be just as dangerous as the original condition. Also, some people would use braces, but you have to be careful with those. They can hold in the joints for you, but if you rely too much on braces, they will make the joint even weaker than it already is, which is already an issue. So you have to use them to your own discretion, as I've been told. I appreciate you so much for watching and those who made it this far in the video, and I'm glad you are willing to learn about Ehlers-Danlos and hopefully stay updated on it and maybe even donate to worthy causes about studying it. Stay weird, everyone.